Well, welcome. My name is Scott Apnell. We just want to hit a couple housekeeping things. This is, for those of you who have attended a safety peer group before, this is the first time we're doing it via WebEx. So hopefully follow the instructions and you can see the little video. Hello. Hello. There it is. Just quick, some housekeeping things. You should have hit the button that there's a chat box on the bottom right. You'll see a menu. You can select all, or you can pick out a particular person to chat to. So, if you see a coworker or a friend and want to, joke around with them, feel free. But mark my name down, Scott Apnell. If you have any questions, if you're having any technical problems, I'll be in the back with someone who knows more about technology than me. And but we'll be taking those questions. Your audio should have been muted when you logged on. Please keep it muted because it makes a mess if it's not. We'll put your questions there. If it's something the presenter's saying and you just need a quick clarification, we may interrupt the presenter, but generally we're going to try to keep them all to the question and answer at the end, and we have set aside a half hour or so for that. So there should be plenty of time for that. Okay, there are 150 people who registered today, which is fantastic, so thank you to all. For those of you who've never attended a safety peer group before, it is an OSHA Alliance program that we run here out of Lehigh Valley Health Networks, occupational medicine. It is generally a quarterly session. We've in the past been doing it in person at Lehigh Valley Hospital, Muhlenberg. We wanted to try it as WebEx for everyone's convenience, but also so our friends in the Schuylkill, Hazleton, and Pocono area could join us. So hopefully you enjoy. Safety Peer Group is a free session that we put on occupational medicine and safety topics, since that's our sole focus and our passion. And the reason we have peer in there is the best information comes from each other. So that's why we always encourage the interaction on the chat. Any experiences or questions. Everyone in attendance is usually in the same general HR, safety. They probably have the same issues, so hearing about that is helpful to all. Okay, I think that's everything I wanted to hit, so we'll go on to the people that we actually want to hear from. So first up of our three speakers is Dr. Kevin Vrablik. Dr. Vrablik is a board-certified occupational medicine. He's a medical review officer. So when people take drug tests, and there's an issue, he's one of the people reviewing them. He's licensed to do commercial motor vehicle exams, aviation medical exams. He's been practicing for 25 years. He is one of our doctors at Healthworks in Lehigh Valley. He is also the medical director for Lehigh Valley Health Network's Employee Health Office. We employ about 18,000 people, so we see our share of issues with that, so he can speak to that. He's also been a member of Lehigh Valley Health Network's Medical Marijuana Task Force, which was started in 2016 in preparation for this law and how it's going to affect things. With that, I'll turn it over. Thank you.
Thank you. Good morning. I gave Scott my slides on Friday, and I got an email back from him, and he said they were lit. And I said, I hope my presentation doesn't go up in smoke. So those are my puns for today. So I'm going to spend some time on updating everyone on medical marijuana and its bearings on work and occupational medicine. We had a safety peer group a year and a half ago, I think, that we started on this, and I'm going to update on that, okay? So this was one of the slides I used back then that I thought was kind of funny. You certainly don't want your pilots smoking marijuana, right? And you don't want to see this in your office where your workers are all enjoying themselves and not being productive, right? So in reality, we have a law in Pennsylvania that went into effect in 2016, and we actually now have medical marijuana in the community. So there's a couple of dispensaries in the area that are actually giving out products now after patients have been certified by their physician with one of 21 legislated serious medical conditions. I'm going to go over those real quick because it was initially 17, now it's 21. So there are people out there using these products. In Pennsylvania, the law does not allow folks to smoke dry leaf marijuana at this point, okay? There is dry leaf marijuana available in the dispensaries, but it's only for vaporization purposes. So you would have to have one of those vape pen devices or a nebulizer or something like that. You're not allowed to burn it and smoke it. So, so they say that Pennsylvania took the fun out of marijuana. So, so most of the products are topical, oral, or these vaporization products. The 21 conditions are all listed here. They added 4 since the initial law came into effect, and that was for opioid addiction, chronic pain, terminal illness. They changed some of that around, but as you can see, these are kind of widespread, and each one could, some of them could contain several different diagnoses in there. So what the physician, only physicians can certify patients to use medical marijuana. They're not prescribing, they're certifying. So what the physician does is say, yes, this person has amyotrophic lateral sclerosis or Lou Gehrig's disease, and by saying that, they believe that potentially medical marijuana products might help their symptoms. Medical marijuana is not a cure for anything. It is simply a product that can help with symptoms of any of these 21 conditions. So the dichotomy that we all know is under federal law currently, this is a Schedule I substance. Any marijuana product is a Schedule I substance, which means it has no medical use. It's highly addictive. There's no research that shows that it's something that's curative or a treatment for anything. So that's where it's coming from the federal law. Under state law now in our state, we can use medical marijuana products for those 21 conditions, except where employees may fall under federal regulations. So commercial drivers, pipeline workers, FAA, so flight, anything to do with flight. Government employees can't use medical marijuana products because their drug test would be certified positive under federal law, not our state law. So, so there is one currently available prescription medication that contains THC, tetrahydrocannabinol, and that's the generic name is just dronabinol, or the brand name is Marinol or Syndros. Syndros is I believe, a liquid or a sublingual, and Marinol are pills. So those are available and prescribable by a physician for treating chemotherapy-induced nausea and vomiting, anorexia associated with HIV, advanced HIV and AIDS. And that will cause a positive marijuana drug test for tetrahydrocannabinol. So the interesting thing with this is sometimes, you know, you'll get into patients using this, but they might also be using marijuana products. And I just lost my slides, Scott. So, we have a little additional test that we can do to differentiate Marinol from illicit use of marijuana, because Marinol is a synthetically produced THC in pill form. So there should be no other byproducts of marijuana use in that. So tetrahydrocannabivarin, which is a byproduct of burning marijuana, shows up in people that are smoking marijuana. So we can actually test for THCV in those specimens that are positive for dronabinol, thank you, to determine if it's from dronabinol use or illicit use. Unfortunately, this doesn't work for medical marijuana because medical marijuana has the whole plant in it. It's basically, they grow the marijuana plant, they extract the chemicals that are in the marijuana plant, which can be THC, CBD, all these different, there's hundreds of chemicals that are in this plant, and they're packaging that into these products. So THCV can appear in medical marijuana products. So unfortunately, there's no way for us to use that to say whether they're using the medical marijuana product or illicit marijuana. So like I said, there's no way for us to right now differentiate between medical marijuana and illicit marijuana use. So, and of course, the worry is someone that presents with a positive drug test, is that drug test positive because they're using medical marijuana, or is that drug test positive because they're using marijuana? We don't know. Or are they using dronabinol, which we could figure out from our testing. So, so in our situation at Healthworks, when people have a positive drug test for marijuana, we have 5 MROs, I believe, who are certified physicians by the federal government to review drug tests for the federal government, but we also do it for non-federal purposes because it's a smart thing to do. If a drug test comes back for marijuana, we interview the person. If there's no medical explanation for that, it's certified as positive. If they present a medical marijuana card from our state, we usually ask for receipts from a medical marijuana dispensary to prove that they have used medical marijuana products. And then we would certify that drug test as negative in the non-federal realm and put on that a concern for fitness for duty. So what you might see when you see MRO drug test results from Healthworks is it'll be a negative drug test, but there may be a comment somewhere on there that due to medical information learned during the interview process, we have a fit for duty concern because of the safety sensitive potential nature of the person's job. Please send them in for a fit for duty evaluation, okay? So a fit for duty evaluation is going to have that person come in, do a medical history, do an exam, and maybe get the job description from the employer, or at least we have it there, and look to see if there's any concerns, because there are sections of the law that say what persons can and can't do when they're using medical marijuana at work, okay? And we'll figure out if they're safe to be doing their job or not. And we'll get back to you on that. So in Section 510 of the law, which is this slide right here, okay, it's got a lot of words on it, but I'm going to go over it real briefly in point format here, is you can't work at heights using medical marijuana in confined spaces or in mining, okay? So if these employees are using medical marijuana, they just can't do those jobs, okay? In Pennsylvania, the law was made to prohibit any life-threatening tasks by that employer. So that was left up way in the atmosphere as to determine what those things are. They were not specific and say, you can't do this, you can't do that, this job can't do that, other than the first 3. So it's up to the employer to determine what could potentially be life-threatening tasks, right? So could it be driving? Could it be, using some specific tool or a forklift or something at work? So those are things that the employers have to determine. And you can prohibit the employee from doing duties that potentially could cause a public health or a safety risk. The other caveat that they put in the law was a blood marijuana level of 10 nanograms per ml and not being able to work with permitted chemicals, federal, state, or local permitted chemicals, working with high voltage electricity, but they didn't say what that high voltage was, or working on public utilities. So if you have somebody who is working on sewer, electric, water, those kind of things, they can't be using medical marijuana and have a blood level over 10. So the problem with that is, of course, you have to do blood work to determine if those people can do their job. So when we're doing a urine drug test, we're not getting blood levels, and we're not going on urine levels. The urine levels are all over the place, and you can't equate urine levels with impairment or anything when they used it last or any of that stuff. It just means that it's in their system. So, so Section 510 is really important for employers to look at and make sure that they don't have any people in these positions that are using medical marijuana. So there's the law. Everyone can look at that at their own time. So the big question is that people have is, can people using medical marijuana work? And there's going to be answers that are sure, and there's going to be answers that are I don't know, and there's going to be answers that are no, right? But we can't say based on the results of a drug test whether the person's impaired, okay? The definition of impairment is a person's not able to do their normal function in a safe manner, right, basically. So with alcohol, we know how that works because pretty much the human body metabolizes alcohol the same. There's a little difference between men and women, but for the most part, it metabolizes at a specific rate by the liver, and we have lots of research that shows at such and such level, it does this to so-and-so people. So that's why we're able to set levels at the federal or state level and say, you're not allowed to do this, you're drunk when it's this, or you can't operate a commercial vehicle when it's this, you're taken out of service, and it's a violation at these levels. So we have lots of data on alcohol. The problem with drugs, marijuana and other drugs, is we don't have lots of data on that, and they're very variably metabolized by people, and they have different effects on different people. So it's really hard to say at the specific level that there's a problem with a person and that whatever you found in their urine. So basically, you have to look at the person and see what's going on with that person. Is their behavior different? Are they showing up late to work when they used to be the most on-time person ever? Has their demeanor changed? Are they making mistakes at work? These are all things that would cause reasonable suspicion concerns, and those are things that most employers have been educated about to look for. Carolyn, I think, is going to discuss reasonable suspicion and that kind of stuff, what to look for in the training that is available for that. So reasonable suspicion, again, is management training, looking for those things, behavioral changes, performance issues, and having suspicion and sending those people for evaluation or drug and alcohol testing, okay? And again, we're going to do that fit for duty test. We may want to get drug and alcohol testing when they're in the office. We're going to do a physical. We're going to want to know the concerns that you had as an employer at the workplace. We may require that person to go to EAP, employer assistance programs. We may want them to go to their doctor, be evaluated, and get us testing or an opinion from the personal physician whether they can work. And the outcome of that visit with us may be that there's no problem, they can work, or there's an issue and they can't work. So I've been on the medical marijuana task force at the hospital since 2016. We meet every month. It's always a very interesting discussion. It's multidisciplinary. We have lawyers, doctors, administrators. We have marketing people. And every month it seems there's new people that come in and some people leave. And it's been very interesting because we know, and I know now, we have people at the network that are using medical marijuana. We have physicians that are employed LVPG physicians that are certified to allow their patients to have medical marijuana. We have non-employed physicians that are allowed to do that. And so it's been a very interesting thing to look at. And we've come up with quite a few policies to guide the use of medical marijuana and certification of marijuana for our patients in the network. And then the whole other thing was, since we receive federal monies, how is that going to affect patients using medical marijuana in the hospital? Okay, I'm an outpatient doc. I don't do any of the inpatient stuff, but that's been a big concern for the network, and they have a solution for it. So your policy, you need to educate your employees and your supervisors. The law doesn't say that you have to inform your employer that you're taking medical marijuana, but you could address that in a policy that, you know, if you're using any medications that could be potentially impairing, you should tell the medical department or the safety department in the company. If you don't have those, you could have that done through occupational medicine when and if they come in through our office for a pre-employment physical. We're not doing blood tests on people. We do urine drug tests, but for the folks that may be doing these prohibited things, you might have to do a pre-employment blood marijuana test if you know they're on medical marijuana to see if they're above that 10, because then out of our office we would say they can't do this, this, or this, because, you know, and we're not saying why, we just say that's what comes out of our office on our paperwork, that they won't be able to do those things. So there are different ways you want your urine drug tests reported. Do you want a medical marijuana test reported as positive with a comment that says has medical marijuana card, because you don't mind if they're using medical marijuana at your facility? So those are all things you need to discuss with your legal counsel, and we have someone here that's going to discuss that, Tim, today as well, partly. So there's the law. You can look that up online. It's actually a pretty good website. It's got a lot of information. It's changed quite a bit. You can look up the medical marijuana certifying physicians on there. You can see where the dispensaries are. I've not personally visited a dispensary yet. The network task force has, and they're pretty well laid out, put together, secure. There's a lot of law behind them. So, and they usually open their doors for folks that have an interest and want to learn about medical marijuana. They're very open about that. just a quick other update on drug testing, because I know that's another thing that people are concerned about. The Fed changed their drug panels a little bit. So it used to be just morphine, codeine, looking for heroin use, and now they've expanded that to the synthetic opioids. So they have hydrocodone, oxycodone, hydromorphone, oxymorphone on their panels now. So it's made us MROs a little busier, because obviously when you add those things, which are pretty common drugs, we have to get involved and review those drug tests now. So there's a whole bunch of new rules about that as well. So if you have a positive drug test on a federal level on any one of those new medications, we review those as we usually do, but we have to make a fitness for duty determination on those, and that requires us to contact or have the treating doctor who prescribed that medicine contact us, have a discussion either in writing or person about the person's ability to work safely using those medications. So H&L, which is our lab, has changed their non-DOT drug testing panels a little bit. They've added the MDMA, which is ecstasy, and 6-MAM, which is the unique metabolite to heroin, to their panels, and they remove propoxyphene, which is Darvocet, which doesn't exist anymore. So they're still pretty much called the same panel. They just have a little bit extra testing in them. So so I won't go into super depth about those, but we do have a sheet of paper, right, that we can send out that has the list of all the things that they're testing for, which is for the better. So just to summarize, medical marijuana is out there. People are using it. Doctors are certifying folks for it. Some of your employees may already be certificated and using it. Others may be thinking about it. We have reviewed positive marijuana drug tests in the office, where people present a medical marijuana card and then present receipts from a dispensary that we've negated and had fitness for duty concerns on. So it's out there. So understand how the law affects you personally as a company. Have a policy on addressing really any mind or mood altering drugs, and make sure you're, again, educated about medical marijuana. So that's pretty much it. And that's my positive Coke drug test cartoon. Oh, yes, and we have brownies today for everybody.
Most of you are watching this through WebEx, but we have a dozen or so people here. So, yeah, we had coffee and brownies, so you missed out. Thank you, Dr. Vrablik. One other note I just wanted to, I failed to mention in the beginning, I mentioned this is an OSHA Alliance program, so we always have OSHA representatives. Scott Schimandel is here, physically sitting here, so if you have any questions that are more specific to OSHA, you can send me those as well, and if one of our panelists maybe it's out of their purview, we'll make Scott come up and answer. And by the way, the questions you submit, I'm not using your name, and I always feel the need to say that since, you know, OSHA. I'm just asking the question, not saying who asked it. Okay, next up. Something just, I'm sure you can still hear me. Something's going on with the presentation. But anyway, we'll get that fixed. But next up, I want to introduce Timothy Gilsbach. Tim is an attorney at Spry. He's been practicing for 15 years. His focus and specialty is on education and employment law. And we've had attorneys from Spry present for us before on other topics. And when we said we were doing medical marijuana, she said, "Hey, we have a drug guy." So this is Spry's drug guy, Tim. Welcome.
Good morning, everyone. My parents are so proud of my notation as being the drug guy. So we're going to talk a little bit about the legal components, and I'm going to talk a little bit about some case law that has come out both in Pennsylvania as well as some other jurisdictions that impact on the issue of medical marijuana. Of course, as the lawyer in the room, I want to give the caveat. It is important, and we've hit on this before, and we're going to talk about it again. Medical marijuana, any marijuana, including medical marijuana, is illegal under federal law. So just to be clear, this presentation is not intended to provide any guidance or assistance in violating federal law. So no matter how many times I've met you, if these guys in the blue and yellow shirts show up and ask questions, if you point and say, Gilsbach told you to do this, I'm going to look right at you and say, I've never met you before in my life. So just to be clear, you know, again, and we'll talk about the federal implications a little bit towards the end. This does raise medical marijuana does raise employment law issues that employers need to be aware of. As we said this morning, you're not required to let people use medical marijuana at work, and you're not required to allow people to be under the influence of medical marijuana at work. But determining whether or not someone is under the influence is a complicated question. And we're going to be, and I'll talk a little bit more about it, but generally speaking, drug testing alone probably isn't going to answer the question of, is this person under the influence? You're going to be looking at things such as, other kinds of signs of whether or not this person is under the influence, because generally, at least, and I'll ask the doctor to correct me if I'm mistaken, but my understanding of it is if you test for marijuana and someone has taken marijuana in the last 2 to 4 weeks, it's going to come up as a positive. It may come up as a positive. In addition to that, the products that are currently made, there has been some effort to remove the components that essentially would make someone high, but the process for doing it is imperfect, and it may come up as a positive drug test. In addition to that, you want to be careful because the conditions that one qualifies to use medical marijuana for, many, if not all of them, qualify as a disability under the ADA, which means even if you can say, okay, you're not allowed to be under the influence of medical marijuana at work, you still now know information about this person, about their medical condition, that may protect them, can provide them protections under the Americans with Disabilities Act, and for those of you who receive federal funding, potentially Section 504. So this raises some employment issues. Like I said, you now know something if you get a positive drug test, if the issue of medical marijuana comes up, you now know things about that employee that you may not otherwise know, that provide them with certain protections. And we're going to talk about one case outside of Pennsylvania that has suggested that it may raise a duty to look at going through the interactive process through the ADA, depending on what the situation is. In addition to that, you want to make sure if you have an employee who is using medical marijuana and you have to discipline that employee for other reasons, you want to be clear to make sure that the discipline is for some sort of infraction and is in no way related to the medical marijuana use, other than potentially doing it at work, or is not related to the disability. And as a lawyer, the best route to do that, I will tell you, is to make sure you document your efforts along the way. Whenever we go to court, I'll talk to witnesses and they'll say, well, we said this, we said that. People on the other side will say, well, you said something different. The easiest way to prove it is if I can whip out the email or whip out the letter and say, we sent this letter on this date to you, the employee. It was written well before there was litigation. It was written at the time. That's going to carry a lot more weight in front of an arbiter, a jury, whatever particular forum you're in. So you want to make sure you're documenting your efforts as you go along if you're looking at disciplining employees. And you want to be very careful when you're dealing with employees where we're dealing with medical marijuana or disability discrimination claims to make sure that we're documenting the efforts as to why we're disciplining the employee. It's rated at the time this is going on because that just carries a lot more weight. I'm going to talk to you, there is not a lot of case law applying Pennsylvania's medical marijuana statute. So I'm going to take you through some cases that have in other states that have applied them. Some of them you've probably heard about in the news, and I want to point out some differences between Pennsylvania's law and these other statutes because it's going to matter. Every state that has medical marijuana has its own statute, and some of those statutes have different provisions in them, especially as it relates to whether or not there are protections in the employment context. And the first case I'm going to talk about is an older case, before we really got into sort of many states who are on the bandwagon of legalizing medical marijuana. At this point, I think it's well over half the states have legalized it. But this is a case out of Washington State back in 2011. An employee was terminated for a positive drug test that was a result of medical marijuana outside of work. Medical marijuana was legal at the time, but the court basically said that it is not a violation of state law in the state of Washington State to fire the employee, and basically also refused to find a violation of a discharge in violation of public policy. The case law has tended to go the other direction more recently. In Massachusetts, we have a case from 2017. A potential employer had an employment offer revoked due to a positive drug test for medical marijuana use outside of work. And again, in all the cases I'm going to talk about, these are people who are using medical marijuana outside of the work context. These were not people who were trying to do it at work. And in this case, the Massachusetts court found that there was not a cause of action under that state's medical marijuana law, but did find a valid disability discrimination claim. And it's not clear where Pennsylvania will come down on this. There may be a direct cause of action under the medical marijuana statute, because as was indicated this morning, Pennsylvania's law has an anti-discrimination provision that says you can't discharge an employee simply because they use medical marijuana outside of work or they have the medical marijuana card. And it's not clear whether or not our state courts will find a cause of action directly under the state law. The statute doesn't answer that question, but there could be the other problem of a disability discrimination claim, and that's what the court in Massachusetts said. Said, okay, fine, there's nothing in the statute that says you can't treat employees differently because you use medical marijuana, but we have a state law and there's also a federal law that says you can't discriminate against someone because of a disability. The medical marijuana use is part of this person's disability. They're using the medical marijuana to treat a condition that's a disability, therefore, they're entitled to certain protections. And the court went a little further, and I think this is what's important for employers to understand, is that it is not, a request for accommodations is not facially unreasonable. You can't just take the position, medical marijuana is legal under federal law, we're not going to have any kind of conversation. And the court basically says you have to engage in the interactive process. So if your position as an employer is you have to have a negative drug test to continue to do this job, whether because it's a federal requirement or it's our requirement, you have to then go through the interactive process with that employee to determine are there other accommodations that can be had to work with this employee. So you want to be aware of that. If you're dealing with that situation, you can't just say, okay, you got your positive trust, you're out of here. You probably want to go through the interactive process to determine are there other ways to address this disability. The next case is a case out of Connecticut. And in that case, again, we have another employee fired for a positive drug test, medical marijuana use outside of work. In that case, they found that the Connecticut law provided that there was a direct cause of action under that state's medical marijuana statute for an adverse employment action. Their statute is relatively similar to Pennsylvania, so I will suggest to you that I think a Pennsylvania court might buy into this view. The other thing that they did hit on is that there is nothing in federal law that prohibits the hiring of a medical marijuana user. And the reason I bring that up is Pennsylvania has a similar provision to what is in Connecticut law that basically says that there's a provision that they put in there that said there's nothing in the statute that will prohibit that requires an employer to do something that's a violation of federal law. And some people have tried to sort of view that very broadly and take the position of, and in this case, the employer they received federal funding, and they basically said, look, we received federal funding, therefore we got to comply with federal law, and that means everybody who works has to have, come back with negative drug tests. And the federal courts and the court said, no, not so fast. The court said there's nothing in federal law that says it's illegal for you to employ someone who is in violation of federal law. It's sort of like the example of, okay, if you have employees who themselves are violating federal law, say they're engaged in tax evasion, the fact that you employ them is not in violation of federal law. And I think where you're going to see some breakdown in this is if you have requirements under federal law, under the Department of Transportation, whether you have drivers, airline pilots, those kinds of things, where it's clear federal law says you must have employees who have negative drug tests. That I think you can hold on to. If, however, you just receive federal dollars and really that's sort of an attachment to your grant, that's probably a different case. And in the case in Connecticut, you're going to say that's not enough. Because again, there's nothing in the grant that says if your employees are out violating federal law, that's on their own time, that's their thing, and you're not violating federal law by employing them. There's a case that made some news recently this past summer out of New Jersey, and I bring this to your attention. In this case, the employee was fired after a positive drug test for medical marijuana. After he was apparently using medical marijuana outside of work, he was involved in a work-related accident. They did a drug test. Positive drug test came back. In that case, the New Jersey court found that there was no provision in their state statute to protect employees. And I bring that to you because it was probably on the news, but you want to be careful here because New Jersey's law is very different than Pennsylvania's law. Pennsylvania law has a very clear-cut anti-discrimination provision. New Jersey law doesn't. I'm not sure if they're going to add one in the future. As it currently stands, basically there's nothing in there to protect employees. And the New Jersey court basically says that. That's very different than what we have in Pennsylvania. There's a case of, in the last couple of months right out of Delaware, just to our south. We had an employee who was terminated. And again, the employee, that statute provides it has an anti-discrimination provision. And the court in that case said you can bring a direct cause of action. There's an anti-discrimination provision. You fired this employee because they were using medical marijuana. Therefore, they can sue you for firing them. The court went on to note, and again, very similar to the court in Connecticut, and their statute is very similar to what we have here in Pennsylvania, went on to note that accommodating employee by the fact that due to the fact that they are accommodating them by allowing them to use medical marijuana outside of work is not a violation of federal law. Because again, the situation is you're not requiring the employer to do anything illegal. I do want to bring one other case to your attention that came out of Pennsylvania. It's sort of an unusual case. It's not directly related to medical marijuana, but I also found it slightly entertaining, though. It's a case in federal court. The employee was using marijuana, but they were self-medicating. They didn't have a prescription. They didn't have their card. And they turned around and sued their employer when the employer found out they had a positive drug test. The employer turned around and fired the employee for their use of an illicit drug. And the employee filed a disability discrimination claim, saying I was using this for, I was using marijuana, not medical, but just regular marijuana for this condition. The court, I think, went out of its way to find a way to not allow this employee to go down this road. But I think they didn't directly deal with the issue of medical marijuana, but they went out of their way to basically find that the condition in question, some sort of, I guess, condition with the employee's leg, was not a disability under the ADA. And I think probably, sometimes we see this situation where you have judges who get a little creative when they have an interesting fact pattern. And I suspect in this case, the judge looked at this and sort of said, I don't really want to encourage people to start self-medicating with these sort of things. We have a provision if they want to use it. And so in this case, the employee's case was dismissed. But I don't think that that's necessarily indicative of what will happen with employees who are actually complying with the medical marijuana statute. All right, so we're going to talk a little bit about the federal law implications. It's still illegal under federal law. For those of you who receive federal dollars through grants, whatever, you want to double check to see what requirements there are under there. And again, the case law that we've seen thus far has indicated the mere fact that you receive federal dollars probably doesn't mean you can necessarily treat these employees differently, but you want to be very careful to see what the provisions are. And it's also important to know that federal agencies do have wide discretion in terms of what they are going to do about this sort of issue. In the past, there has been an assumption that if you're complying with with a state medical marijuana statute, employers are usually going to get some leeway. The only thing, in this day and age, of course, things in Washington are not what they used to be. The predictability in Washington just isn't what it used to be. So I bring that word of caution to you, those who receive federal dollars or rely heavily on it, especially, I do a lot of work with school districts. We kind of caution you to be very cautious. The old rules of what used to go on in Washington is just not what it used to be. And so there is always the possibility that, some federal government, some, bureaucrat decides they're going to start going after people for this. You want to be careful. The Department of Transportation has ruled that it is not a legitimate medical reason for a positive drug test, as to the extent that the Department of Transportation requires drug testing, like I said, for airline pilots, certain drivers, those sorts of things. All that being said, the head of the FDA has suggested he envisions changes on the forefront. It hasn't happened yet, but we have, as I said, more than half the states have legalized some form of medical marijuana, and we're envisioning that there will be some kind of change coming down the path. The other thing to be aware of is, and sort of this is, I guess, more of a side issue, but there is an attachment to the federal budget that prohibits federal prosecutors from prosecuting people who are using medical marijuana if they're doing it consistent with medical marijuana law, which means for the most part, your employees who are complying with Pennsylvania's medical marijuana statute if they're using it appropriately in strict compliance with the statute, they are not in risk of being prosecuted by the feds. However, to be eligible, you need to be in strict compliance with the state law. You have to make sure you can, so our employee who was self-medicating would not qualify for those protections. In terms of what is on the horizon, Trump has sort of said, has given somewhat of a waffling kind of position on this issue. He has stated he supports state laws that permit the use of medical marijuana, but has also indicated his belief that the federal government reserves the right to continue to go after people who use marijuana in any format. Congress has given sort of a mixed message on the issue. We've seen everything from people who want to clearly allow medical marijuana across the board to people who are pushing heavily for some kind of crackdown on it. So as employers, you want to kind of keep an eye on what's going on and be aware for any eventualities. So at this point, what do you do as an employer? First of all, you want to make sure you have a well-defined policy on the issue and ensure that it's consistently applied. And again, this is going to help you in any kind of discrimination claim if you have a set policy that says this is what we do under these circumstances and it is consistently applied. The other thing you want to be careful of is if you have a policy that uses the phrase illegal drugs, I would spell out whether or not you are including medical marijuana in that provision, because it is open-ended at this point, and a creative lawyer is going to say, does illegal drugs include medical marijuana? Because under federal law, it does. Under state law, no. So you want to make sure that you're clear about that in terms of that we are including that in terms of, okay, you can't bring it to work. You can't be taking it while at work or be under the influence of it at work. You want to be careful about using only a drug test to enforce your drug-free work policies. Again, if you have an employee who is using medical marijuana, even if they're not taking it at work, even if they're taking it, say, late at night, it's out of the, they're not under the influence of it anymore, say that when they come to work at 9 o'clock in the morning, a positive drug test is they're likely to have a positive drug test. So you want to look for other sorts of indicators of possibly being under the influence. If the issue arises, you want to make sure you go through the interactive process as you would with any other kind of disability concern. And also consult with, and I'm putting a plug in for all lawyers, but you want to consult with your counsel when dealing with these issues, especially until the law becomes well settled. Because I think as we had, the statute was passed in 2006. We're currently sort of in the position where employees and folks are able to purchase this stuff. Most of the dispensaries, I think, opened up in the last 6 months or so. So we're going to start to see this issue come up more frequently because the stuff's available, and I think we'll start to see a situation where an employee gets fired, files a lawsuit, and it takes some time for these things to work its way through the courts, and we'll start to get some direction from the courts as these cases come up. But until that happens, we're sort of kind of in a gray area in terms of the things you should be doing. With that, our next speaker's up.
Thank you very much. I don't want to brag, but I just want to point out that I just got a doctor and a lawyer to stick to their time limit. Come on.
See if you can work that with a therapist.
I would never try that with a therapist. Therapists are usually cutting me off.
Yeah, right.
Come on, that was a little funny. So next up, we have Carolyn Lamparella. Carolyn has been practicing, she's a licensed professional counselor. She's been practicing for over 20 years. She was 12 when she started. In addition to being a licensed professional counselor, Carolyn is the director of Preferred EAP, which is actually owned by Lehigh Valley Health Network, and they are our EAP for our 18,000 employees, but they also service other clients as well. They're not just exclusive. So Carolyn is one of our favorite speakers and goes out and speaks with a lot of companies in the area for a whole host of mental health topics. So with that, she'll talk a little bit more about this topic.
Good morning. Okay, let me make sure I know how to do this. There we go. Okay, great. So I'm going to switch gears a little bit and talk about what we do at Preferred EAP. Our primary role is to help employers figure out what to do when they actually have an employee that tests positive or if they have employees that they are concerned about. So I'm going to talk a little bit about substance use in general, reasonable suspicion, how supervisors and managers can intervene, And then once it has been determined that there is a problem, what do you do about it? Because those are the questions that I usually get, the phone calls I usually get from employers are, I have this very valued employee who I'm deeply concerned about or who has tested positive. We don't want to let them go. Please help us. Those are the kinds of calls that we get frequently. So we talked a lot, this morning we're talking a lot about marijuana, but I'm going to sort of look at substance use in general. And I wanted you to take a look at this chart or this diagram to give you an understanding of where medical marijuana fits in the broad spectrum of substance use. This is a survey that is done every year on substance use, in America. And as you can see from the yellow circle, the yellow portion of the circle, alcohol is still our #1 concern. We're hearing a lot about opioid use and medical marijuana, but we are still primarily concerned about alcohol. That is the #1 problem that employers are experiencing. And so out of these folks who are using substances, as you can see, I know I can't step away too far, but this section right here, the age group of 18 to 25, those who do have substance use concerns, that's the age group that generally requires treatment. And, I don't know if that matches your workforce. Some people have an aging workforce, some people have a young workforce, but that is a really vulnerable age category, 18 to 25. And one of the concerns that we have with regard to substance use disorders is we are definitely getting better as a society in creating treatment programs for those who are using or who have substance use disorders, but we are still lagging significantly. And so unfortunately, many of those who require treatment don't have access to treatment. And so one of my hopes is that you as employers will begin to see yourselves as instrumental in this process, because there is good news. What we know is that when an employer, when an employer gets involved in supporting their treatment for employees, we know that the success rate is greater than if just a family member or a loved one says, hey, you got a problem, you need to do something about it. And, we can all kind of guess as to why that is. It's because people want to keep their job. And so when employers get involved, the success rate is so much higher. And so that's why it is so important for you as an employer to really have a strong policy that supports your employees. Because what we know is that we used to criminalize substance use, and we are moving, on the spectrum toward treatment. We're still not quite there, but we definitely are better than when I began my career at age 12, as Scott indicated. But we have a long way to go. So I wanted to give you just a little bit of information about what we mean when we talk about substance use disorders, because it really is a continuum. We're talking about, I hear a lot when I visit with companies, they say, well, this guy just kind of likes to smoke pot on the weekends, just a recreational user. We don't really think he has a problem. But then you have the other end of the spectrum where you have addiction, and it's a continuum. And as Dr. Vrablik indicated, when somebody tests positive, it's not always easy to know. Where do they fall on this spectrum? And so that's where we come in as an employee assistance program, is to help you determine, how serious is this concern. And so when we talk about substance use disorders, we're talking about recurrent use of alcohol or drugs, causes significant impairment, it causes health problems or disability, failure to meet major responsibilities at work, school, or home. And then that's substance use disorders, but then we're talking about addiction. What differentiates the recreational user from somebody who we might consider addicted to a substance? And, the way we look at it is it's the irresistible compulsion to use alcohol or drugs despite consequences. So these are the individuals who have 2 or 3 DUIs, have, been suspended from work, or have failing relationships, lost, custody of their children. I mean, these are like serious consequences, and those aren't enough to get them to stop using. So, we have the recreational user on one end, and then we have addiction on the other end. And there's a lot that happens in between. And so that's where you come in as the employer. One of the things that we really advocate is that you have a strong policy so that you have some way of intervening, and prevention is always the best. Alcoholism, just to give you, we talk a lot about heavy drinkers versus alcoholism. Alcoholism is a chronic disease. Addiction is a chronic disease, which means it will get worse. So this is why it's so important as an employer to not avoid intervening, to really have a plan for supporting your employees. Because what we know about addiction is it's not going to resolve on its own. It's a progressive disease. One of the things with alcoholism is it has observable withdrawal symptoms. This is also true for opioids. Often when people are withdrawing from opioids, it looks like the flu. I've had calls from employers that said, my employee has been out 2 or 3 times this year with the flu. Okay, maybe it's something else. It's something that we need to look for, because withdrawal symptoms are observable signs and behaviors. Loss of control or alcohol tolerance, again, it's a progressive disease, and there is a risk of death without intervention. So this is more reason for us to get involved. Dr. Vrablik alluded to reasonable suspicion. When we talk about reasonable suspicion, what we're looking at is behaviors. You as the employer, your responsibility is to observe behaviors, your supervisors and managers. We want them observing behaviors because you spend more time with your employees than they spend with their families. So you can really be keen observers and, for your employees and notice differences. We're looking at appearance. Are they normally put together, but lately they're very disheveled, they're not showering, they have body odors, their speech is impaired, they smell like alcohol, they smell like pot. These are things that you want to be noticing and documenting. That's reasonable suspicion. So the supervisor's role is to observe performance, and documentation is critical. And I know a lot of times supervisors, I work with a lot of small companies that are sort of like a family. And, supervisors know the intimate details of their employees' lives, and they're very close. And it makes it sometimes difficult to intervene because they feel they want to help them. And so one of the things that we do in our training is we really help supervisors think about their role and to create some structure to help them, feel comfortable documenting these changes, and to know that if they get involved, they're actually helping the employee, not hurting the employee. Because often people are concerned about people's reputation and they don't want to get involved. And so that, that's part of the training for supervisors, is really helping them understand, their role. We want supervisors confronting the abuse. We don't want them avoiding it, and determining reasonable suspicion. I'm going to be zipping through here because I can see the time. Oops, what happened to my slides? Is that there? Did I do something? I need technical support. So I think maybe it's one of these buttons that I pressed. Sorry about that. Okay. So a supervisor's role is not to diagnose. And again, this happens often in small companies. I will get a phone call where a supervisor is telling me, I think they are depressed. I think they have bipolar disorder. I think they have, they're an alcoholic. It is not a supervisor's job to diagnose. You leave that up to the professionals. It is just the supervisor's role to document behaviors and whatever they observe. They do not provide counseling. I hear this also from HR directors. They call me and they say, I'm not a counselor, please help me, because it's not your role to counsel them. It is your role to guide them, to observe behavior, and to get them to the appropriate resource. It's not your job to act as a police officer, to catch people in the act. Those are also phone calls I get often. What should I do? Should I follow them out to the parking lot? No, we do not want you acting like a police officer. The key is to observe change. Again, physical appearance, personality, behaviors. That is what we're looking for. Warning signs, absenteeism, as Dr. Vrablik indicated, if your employee is absent more than normal, if they're careless on the job, if their accidents are increasing, they have inadequate job performance, they can't seem to make decisions or follow through on tasks, poor coworker relationships, or mood changes. And again, what we're noticing is differences. We all have employees that sort of are difficult employees, that are just always difficult employees. That's not what we're talking about. We're talking about employees who are acting differently than normal. And that's where your observations are so critical. Some physical signs to look for: change in appearance, poor physical coordination, fatigue, and I'm talking about excessive fatigue. We have a lot of, night shift workers who are just normally tired. We're talking about people who are falling asleep at their desk. Those are the kind of phone calls that I frequently get. Bloodshot or dilated pupils, look in the eyes. The eyes tell all, and that's a good indicator of what's going on. Needle tracks or marks, slurred speech, chronically inflamed nostrils or runny nose could all be signs. Supervisor's tasks, again, are to document. Be consistent. You do not want to be targeting people. And again, this goes back to some of the legal concerns. You want to be implementing your policy the same across the board. You don't want to single people out because you know their background. If you know their personal life, you may be tempted to sort of zero in on them. You've got to be careful about that. Be prepared as a supervisor. Have your documentation before you sit down with an employee. Present the written documentation. Focus on job performance. You're not going to be discussing with them what you saw on Facebook about them, okay? That's not what we're talking about. We're talking about observing their job performance and staying focused on that. We know way too much about people because of social media, and we have to be careful about getting influenced by that. We want to stay focused on job performance. Do not judge or diagnose. Do not tell them how much they're hurting their family. Do not go into their personal life. You stay focused on the job. Be straightforward. Maintain confidentiality. That is absolutely critical. One of the things with substance abuse is there is a tremendous amount of shame associated with it. Think about it. If somebody has a substance use disorder versus somebody who has cancer, you're not going to put up on Facebook, so-and-so just, got admitted to rehab. Please pray for them. We don't see that. There's a tremendous amount of shame associated with substance use disorders. So you want to make sure that you protect their confidentiality and assure them that help is available. You want to refer, and that's where your employee assistance program comes in. Make sure you know your resources. And if they're not quite at the level of reasonable suspicion and they haven't tested positive, you could offer other resources, that might be helpful to them. But know your resources. And if you don't know your resources, call your EAP program and find out what's available so that you as a supervisor feel confident. Follow-up is critical. One of the things that we know about substance use disorders is relapse is part of the process, And so an employee may come back to work, they may have received treatment, but and so you think everything is great. But relapse is always a risk. So you as a supervisor, a manager, you want to stay engaged with that employee and remind them that you're still available. Follow-up is critical. Some of the traps that supervisors get into, avoidance. It's very easy to sort of, say, oh, I know, it's not that big of a deal. Things will work out. Minimizing is a big problem that we have when it comes to substance use disorders. You as a supervisor or manager may feel reluctant to get involved, so you might minimize it. You might normalize it, helplessness. You may feel helpless about how to deal with it. And in that situation, you don't want to avoid it. You want to get help for yourself so that you intervene. Overwork. A lot of people say, I just don't have time to deal with it. Denial. Fear. There's a lot of fear when it comes to this issue. That's why it's so important to have an EAP program or a resource that you can lean on, because you don't want to allow your own fear of legal ramifications, of whatever you're concerned about. You don't want that to be your guide. You want to stay focused on helping this employee. Friendship. Again, you know, I work with a lot of small companies, and a lot of supervisors and managers are friends with their employees, and that can blur boundaries. And so, again, it's really important to have a policy and a structure in place to help you. Again, knowing your substance abuse policy, what does that mean? You have to be able to answer this question. What happens if I refuse to take the test? These are questions your employees are going to ask. What if the test result is positive? Make sure you know what is going to happen. You know, a lot of people are concerned that they're going to be fired. You know, if your policy gives them a second chance, make sure you know that and tell them about that. Is there a program available to help me? Yes, after reasonable suspicion is determined. This is something I want to make sure to emphasize because I hear this from a lot of companies. You must escort that employee to the testing. Often people will say you need to go to, you know, Healthworks to go get your test, and they drive on their own. They show up at Healthworks, they test positive. Okay, you've just put somebody in the car that is impaired. And believe it or not, it happens a lot. So you want to make sure to escort that employee, whether it's putting them in an Uber, in a cab, taking the bus, you know, do not allow them to get in the car. Written records should be completed. You want to make sure you have your documentation. It is not essential that you have an idea of what substance they're using. That is not your job. Your job is just to identify the behaviors that are a concern. Okay, your EAP program. I'm zipping through this real quick. We, as the EAP, we do a thorough drug and alcohol assessment to try to determine where does this individual fall on the continuum, and then we make treatment recommendations and we follow up, and that is critical. We make sure that they're getting the help that they need, that they're succeeding. If it's not the right fit, we try to find another fit. We stay with them through the process. We don't just refer and say good luck, and that is really important that your EAP do that. All of our records are separate. Our records do not show up in the employee's records. You want to make sure that they understand that, and we are completely confidential. After they return to work, you want to provide continual feedback. Again, relapse is a concern, so you want to stay engaged with that employee. You want to give them time to adjust. Now, you know, we try to protect confidentiality, but when someone is all of a sudden gone for 6 weeks, there's going to be a lot of talk at work. And so when they come back to work, they're going to feel really vulnerable. And so you want to make sure to support them through that process. Show respect for their privacy, provide open communication lines, and renew corrective action if behaviors surface again. So again, we're always concerned about relapse. Once they've received treatment, we don't want to just, you know, let them fend for themselves. We want to stay engaged in that process. And that's it. Thank you very much. Yes, although there will be questions. I'm sorry, I feel like I just said through that.
You guys want to come up and speak?
Sure.
Okay, Tyler, can you switch the view? Okay, so we're going to get on to the question and answer section. We had 10 questions actually submitted even in advance, and I believe most, not all, were actually addressed in the presentations. But I am going to go through first some of them that were asked in advance, and then we'll open up. We've had some that came in during the presentation. For the people who are physically here, hello, for the purpose of everyone on the WebEx, you need a microphone or else they won't hear the question. So Tyler will be playing Phil Donahue if you're young or old enough to know who that is. He's not. But he'll be running around with the microphone if you have a question. So the first one I wanted to, I have them in 3 places here. As you can see, they're there, and you guys can share who wants to chime in on these. First question is, what should companies be prepared for when marijuana becomes legalized in New Jersey and we're a Pennsylvania company that hires New Jersey residents?
I assume the question means recreational use, because both
Yes.
states have medical.
Yes, recreational, sorry.
As it currently stands, employers are free to say an employee cannot use marijuana if it's not for medical purposes. They're free to say you have to, the same way would any other illegal drug. It's still legal under federal law. It's still legal here in Pennsylvania for recreational use. So I think under those circumstances, you want to delineate in your policy very clearly that it's outlawed. that it's prohibited and that, either what the consequences for that would be. The only other caution I would give is make sure that that policy is consistently applied.
Dr. Vrablik, I can speak as an MRO to that. So that drug test is going to come back positive to the medical review officer in the occupational health program. The MRO is going to review that, contact the donor, ask for documentation that says that in Pennsylvania they have a medical marijuana card and are using a medical marijuana product. So in that situation, they're not going to have that. They're going to be using their recreational marijuana from New Jersey. They're not going to have documentation that provides medical explanation. So the MRO will certify that as a positive drug test for the employer.
Great, thank you. This next question came in kind of twice in two different ways, so I'm going to kind of combine them, and this one might be a bit of a free-for-all. So the first way it was worded was, is an employee required to notify his or her employer if he or she is a medical marijuana patient? And the extended version of that is if they, do the employees, are they required, it was saying, are they required to disclose so the employers have an opportunity to implement reasonable accommodation? And there is a part 2 to that one too, but maybe hit that one first.
The medical marijuana statute does not require disclosure. My understanding is from advocates who supported the passage of the law is that they are encouraging employees to identify, to tell the employer, I use medical marijuana. In addition to that, obviously, if an employee says that, that also gives them the protections of the statute. If an employer doesn't know you're using medical marijuana and they fire you, you can't say, well, it was because I was a medical marijuana user if you didn't tell them that. And in terms of reasonable accommodations, yes. If the employee is asking for that, they would have to disclose at that point in an effort to make the accommodations. Now, if an employer doesn't know about that or doesn't know anything about the disability, there's been no request for an accommodation. I think the employer can safely proceed as they would with any other employee. Generally, if they're seeing something that raises some suspicions in their mind, they may want to say, what's going on here, and see if that begins a conversation.
Okay. And part 2 of it was if they don't disclose and there's a job-related incident, what legal protection is there for the employer? And the example was given, we have jobs operating heavy equipment, but if they were to disclose their medical marijuana, there are plenty of other jobs that they could have given, that they can give them that will keep them out of harm's way. And, they feel like they should have had the opportunity to provide that accommodation, and they could have if it was disclosed. So what is their protection if the employee doesn't disclose and then they get in an accident?
I think from a legal perspective, their position is you can't be responsible for things they either didn't know or shouldn't have suspected. So if you have an employee who's using medical marijuana or any other drug that would impair them, and they don't tell the employer, or there's nothing to indicate to the employee, or gee, this person appears impaired or anything like that. From a legal perspective, the defense would be, gee, we didn't know about it. There's nothing to suggest we should have known about it, and therefore we can't be held liable for that. Obviously, if from the human perspective, sometimes lawyers are accused of not being truly human. I think obviously, as we talked about earlier, employers should sort of be on the lookout for, okay, are we seeing any signs that are concerning, that the person might be impaired, that kind of stuff. When you talked about some of the signs to be on the lookout for. So obviously you want to be on the lookout for that, and if you do see them, sort of act on that to see what's going on.
Okay. This one I think is aimed more for Dr. Vrablik. The question is, does medical marijuana cause the same level of impairment as recreational marijuana?
I don't know.
I could have done that.
You can't determine impairment from the result of a drug test. You determine impairment by the behavior of the person. So if they're using illegal marijuana, medical marijuana, whatever marijuana, and they have behaviors that are outside their normal behavior that are affecting their ability to function normally, then they're under the influence and impaired by marijuana or whatever drug that they may be taking. So the interesting thing I can comment on recently is drug tests that are coming back positive on folks that are providing documentation of medical marijuana use. The levels in the urine are higher than what the lab tests for. So H&L tests for up to 750 nanograms of per ml of marijuana in the urine. And these folks, it's over 750 on the couple that I've seen. And when I've seen drug tests from recreational users, it's, you know, the cutoff is 50 for the screening test and 15 for the confirmation test. And I see these results come back, you know, 110, 112, 235, 51, that kind of stuff. So I think, and the reason for that is these products that they're making are highly, highly concentrated THC products, or they also sometimes have CBD in them, which is another active component, but not what we test for. So some of these products have 60, 70, 80% THC in them, in these little tablets or oils or tinctures, and it's creating very high level urine levels, which again, you can't equate to blood levels, nor can you determine impairment from. But that's just something I've noticed recently. So
I actually got a write-in on the chat, which is good information. This is from Monica. She's the pharmacist at Keystone Cana Remedies at the dispensary. She chimed in and said that medical marijuana can cause the same amount of impairment if it is abused or overused by the patient. At the dispensary, we teach at the dispensaries is to find the level of relief without causing impairment. And Dr. Vrablik mentioned, I did go tour, actually, Keystone, because they were the first one open in the state. And you don't just buy it off the shelf. You consult a pharmacist, and it is that interactive process. So I thought that was good feedback to share. Okay. It's okay, there was a safety lid on that. It didn't spill. I have to scroll up here a second. To make sure I'm getting everybody. We did that one. Okay. Suppose an employer makes reasonable accommodations for a medical marijuana user, and that employee ends up causing a situation that harms another employee. Is the employer liable?
I think it depends. It depends on a lot of things. It would depend on what the accommodations were and whether, if they're reasonable accommodations, and assuming they were, you know, looking at them, there was not a reason to suspect that that would put other employees in harm's way, then that would really be the question. So the short answer is it really depends, which is really the answer we always go to as lawyers. But it really would depend on the facts, of the specific facts. And obviously, you know, if you're looking at reasonable accommodations, if it's something that's going to put another employee in harm's way, the argument could certainly be made that that's not reasonable. So therefore, if the only way to accommodate the disability would be to do something that would potentially put other employees more in harm's way than they otherwise would be in the normal course of work, you could take the position that it's not reasonable. But again, that would be a fact-specific inquiry.
Okay. This question it says, we are a federal contractor. In the event an employee tests positive for medical marijuana, once we receive the results, would the proper procedure be to send ADA paperwork, go through the interactive process, and if no accommodation can be made due to zero tolerance policy, the employee would be terminated? Do you need me to repeat that? Because I kind of stumbled.
No, I did get it, okay. And I agree with pretty much every step up until you get to, you know, the interactive process. And the question then, in terms of terminating the employee, it would depend on the specifics. I don't know. I would be cautious about going to that route. I think you would have to go through the interactive process, see what the outcome of that process is, and then decide what the next course would be. And probably when you get to the point where you're starting to have the conversation about the interactive process, I would suggest you bring your legal counsel involved.
Okay. This one's a question with a little bit of a conversation involved to it, so I'll keep you up to date. The question was, do CBDs impair in any way? And Monica from Keystone replied saying CBD is non-impairing, but that is not to be confused with not impacting the mind. It has a calming effect, but not to the point of sedation for most. And then the comment back was, so it can impair, but it is not tested for, correct? Is that correct?
Correct. The panels that we receive from whatever, whether it be Quest or H&L, are not testing for CBD. That's not one of the substances that's covered in the Drug-Free Workplace Act. So, but again, it's all about behavior, right? So if someone's taking a CBD product and nothing else has changed except that they're taking a CBD product and their behavior changes, then you have to worry that they're impaired by that medicine or by that product.
Gotcha. Okay. Another question I have is from a legal point of view, and this EAP might be involved in this too, what is the recommendation? The old way used to be zero tolerance policies. Everybody had it. I don't want anyone having drugs in my workplace. So you get caught, you're out. Some people are recommending that that is not the way to go anyway, for a variety of reasons, that the recommendation is to do a second chance program. Could anyone kind of comment on what they feel about that?
From the legal perspective, I think it makes sense to talk about a second chance program for a couple of reasons. First of all, people make mistakes. Second of all, if you have employees who you've invested time and energy into, to automatically fire them, can be costly. It's a human cost of doing that. The only caveat I would give is you would want to make sure you have it in a policy in terms of how we handle the situation, and it's done consistently. If you have a second chance procedure and you're going to do a second chance, you got to consistently do a second chance. And to the extent you're going to have exceptions where it's an automatic termination, it needs to be clearly spelled out when those circumstances are. And again, it's that it's done consistently to avoid any kind of potential discrimination claims.
What I would say about that is, we typically recommend that employers have a second chance policy because we have seen success in employees returning to work and continuing to stay clean or sober. Our particular data at Preferred AP is about 50% of those who are referred to us with a drug or alcohol problem, once they receive treatment and they return to work, a year later they're still employed and have not tested positive again. We always recommend random drug testing for that employee, whether they're, the company tests randomly in general or not. We recommend that employees who have substance use disorders are tested randomly. And that's, it's a structure for them that helps them stay clean and sober. And I guess as an employer, you have to decide what's most cost effective for you, because it costs a lot of money to retrain, employees. And that's often what we hear is, they're a valued employee, they've been with us for a long time, and we really want to help them. But as Tim indicated, you want to make sure that you're doing that consistently across the board. If you're going to do it for one employee, you really need to do it for all, and that's why your policy needs to reflect that second chance.
That actually was one of my first interactions with Carolyn, a company who we provided drug testing and other things for, called and said, and they were very blatant about it, they just said, we have a 20-year employee who is the rock of this place, and he just failed a drug test. We don't want to fire him. So they, as a company, made a policy for all employees going forward. This next question, this is something that someone had asked me actually at a SHRM meeting I was at, is there such a thing as mandatory, and there's also a writing question that's kind of part two of it, but is there such a thing as mandatory EAP where you require an employee to go for mental health or EAP services?
Yes, absolutely. We do, and with most of our employers, we have a procedure in place with them where if they have concerns about an employee and their behavior has reached the level where it's really impairing their work performance, they can mandate them to receive EAP services as part of the second chance. Now, I often get pushback from employers, there's a lot of fear, and maybe you can weigh in on this, Tim, about having a mandatory referral process in place. What I always tell employers is if the employee refuses to come to EAP, you're not going to fire them for that. You can't force them to come to EAP. It's an opportunity. It's a resource available to them to get help. If you're going to fire them, it's going to be based on their work performance, period, not because of their refusal to go to EAP. So a mandatory referral process is just an opportunity for that employee to get help and support. You're just giving them an option, and saying, look, your work performance has declined to the point where we need to make a decision about your employment. We'd like to offer this to you as a resource. If you want to continue to be employed, you need to address this problem. This is one way to do it. So I don't know if you want to weigh in on the legal aspect.
I would agree with that. I mean, I think if you have a situation where an employee's work performance is suffering, and you have that conversation, you offer that, some level of services, they can go out and do that. And the employee says, I'm not going to do it. Okay, fine. You tell the employee, if your performance doesn't improve, we're going to terminate you. So the termination would be for, that their level of service is below what it should be, below expectations. And again, you're offering them that opportunity. I think you explain it the way and say, this is an opportunity, and if you choose not to take advantage of it, that's your choice. But likely without some change, the level of performance is going to continue to be on the decline, and you're going to be terminated for that.
Okay. Dr. Vrablik.
I can speak from the very early part of that, when we're seeing people in employee health at the network. We have 18,000 people. We have all sorts of stuff that goes on at the network. And so we have people that have issues in the workplace. They're sent to employee health to be evaluated, and it's Dr. Pelosi, it's me, it's any of Dr. Dolphin, some of the nurse practitioners rotate through employee health, and we're the ones that see these people and are given the documentation from the workplace about what's been going on. So we have that medical conversation with the person, try to figure out if there's something medical going on or mental health going on, and a lot of times we've already made the decision before we see them that this person needs to see EAP because of what we already know about what's going on. And in the conversation that you have with the person that's with you, most of the time they're agreeable to that because they realize, yeah, stuff's gotten so bad, whether it's at work or at home, that it's affecting their work. They know they have to get help. So when you say, you know what, I have to take you out of work because I'm concerned for your safety, health, at work, your coworkers, and I think, we have to mandate you to go to employee assistance. Most of those people they want to do that because that's a cry for help, right? So the process is we take them out of work from our from a medical concern standpoint, and we say, okay, you have to go to employee health, be evaluated, and bring back a note from an EAP, or their own treating provider that says you can come back to work with or without any accommodations or restrictions. So in that situation, if they refuse, then they're not coming back with something that says they can return to work. So that would be the other thing that would keep them from coming back. So.
Okay. And the kind of part two of, Tyler, the part two of the question was, it was basically the same question, but if it's suicide, not drug related, but it's suicidal thoughts, you recommend mandating an EAP if there's fear that they may hurt themselves. And I think that's kind of along the same lines.
We would probably handle suicidal ideation a little differently. If someone is actively talking about suicide, we don't want to take the time to go through a mandatory referral. We want to get them help immediately. And so we often will have maybe somebody from HR escort them to EAP if they feel like they want to have an evaluation from us. Often we will just send them directly to the emergency room for an evaluation. We don't want to mess around with that. We don't want to take the time, to go through a mandatory referral process. If someone is actively talking about suicide, we want to get them help right away. And I know at Preferred EAP, we always have emergency appointments available, so we would see that person same day. But if it's really serious, we want to get them evaluated at the emergency room, and we want them escorted there. Again, we don't want them sent, and sometimes we'll bring family members in as well so that they can get to the appropriate resource immediately.
Okay. By the way, does anybody here, because I know I've just been reading, does anybody here have any questions? Just feel free to interrupt me. Tyler is walking to the back with the microphone, for those of you who can't see.
A question about section 510. Medical marijuana, if you have the card, you're most likely going to be over the 10 nanograms. Because concerning confined space, working at high voltage, you're going to be over.
So, we don't know because we don't know about their blood levels because we haven't been testing blood levels for folks in Healthworks as of yet because it's been pretty infrequent to have a positive drug test. The urine levels is what I was talking about, and those are huge sometimes in these folks that are using medical marijuana products, but you can't extrapolate and say what their blood level would be. So if you have somebody that does that job, then they need to have a blood test.
Okay.
If they're using medical marijuana, and if they're over 10, they can't do that job.
So the legal question would be, if they're over 10, and that is part of their job description, do you need to accommodate them with a task that do not include that, or can they be terminated?
Under the medical marijuana statute, I think I don't know that you have to do anything, but the concern I would have is the potential for a disability discrimination claim, because whatever condition they're using the medical marijuana for. So I think you have to go through the interactive process and determine, are there reasonable accommodations? I mean, there may be. We give them a position to do something else. But again, that's going to be, the question is going to be, is that reasonable under the circumstances? And that's a case-by-case determination. And again, I probably would recommend you get your legal counsel involved. If you're at that point where, okay, we've got the positive drug test, this person does a job that one of those specific ones that very clearly delineates in the statute, based on the blood test, then I would suggest you get your legal counsel involved as you move forward with that interactive process to figure out what's that going to look like. And the answer may be, we go through the interactive process and there are no reasonable accommodations, in which case you can say to the employee, you got to go. But you still got to go through that process to make sure that you've reached that point.
Okay. Thank you.
One comment, actually, and I'll quote because I'm not a doctor, I just pretend like I am sometimes. Dr. Vrablik, you had said to me one time in a conversation on another topic that sometimes it's the condition. I mean, there's those 21 conditions, and it's actually the condition that prohibits the person from doing the job, not the medical marijuana card. I mean, you saw the list of the 21, and some of those are pretty severe, that it doesn't matter what drug you're taking, if you have that condition, you can't safely be doing the job. I just say that's not so much a question as, please correct me or add to that.
No, absolutely right. So, if someone has amyotrophic lateral sclerosis, Lou Gehrig's disease, and they're using medical marijuana for that, you're not likely to see that person in the workplace. So, seizures are, they're not going to be able to drive if they're actively having a seizure disorder, correct? So a lot of these underlying problems that they're using the medical marijuana for can be problematic for them in the workplace to begin with. And then you'd have to have that interactive process to see if they should have accommodations or not.
Thanks. Question written in here, are there any considerations for, quote, dangerous trades, for instance, working with chemicals, hazardous materials, driving, electric, heavy equipment, etc., trades where impairment can cause great harm to others as well?
I think Section 510 addresses that pretty clearly about what you can't do when you're using medical marijuana, and if your level is over 10, what you can't do.
Okay. And there is, if I'm interpreting correctly, 510, one of the provisions is the company can make a determination on.
Right. There's some leeway in there as well, and I think that's where you have to be careful when you exercise the leeway that the law isn't specific on. So like at the network, we have people that drive vehicles for the network. They're couriers. They run all over the place, down to Lancaster, Chambersburg, up to Hazleton, taking specimens and all that kind of stuff around. And they're not commercial drivers, but they're drivers for the network. So they're not, they're licensed drivers in Pennsylvania. So they're not commercial, but they're not just a regular old, Joe Smith driver. They have specific tasks that they have to do in terrible conditions, potentially of weather and the stress of time constraints of getting things places. So we hold them we can't hold them to a commercial driver standard, but we say, hey, we really want to make sure you're healthy and you've got good vision and hearing in order to do all this stuff. So the question is right, is that a dangerous trade, driving for the network and using medical marijuana? So that's a case-by-case basis because, again, you can't discriminate in Pennsylvania. There's no law that says you can't drive and use medical marijuana. The law is that you can't use medical marijuana and be impaired and drive, just like alcohol, right? So we did have one case in the network where there was a driver that did come forward for his annual driver's exam, disclosed he was using a topical medical marijuana product. We contacted the treating physician, and they said no driving and using medical marijuana at the same time. So that one was kind of taken out of employee health's hands by the treating provider. If the treating provider said yes, then it would have fallen on our plate to decide whether it was going to be safe for them to drive or not, because there is no specific, guidance in the law about that. So.
Okay, that is actually right at the time, and that is the last question I had in, unless someone, we did have one. Oh, I'm sorry. Go ahead.
What has your experience been with positive alcohol results and an employee providing documentation that they have auto brewery?
I'm sorry, what was the second part?
So we basically positive alcohol results and an employee providing documentation that they have auto brewery syndrome.
I've never seen that. MROs don't usually get involved in the alcohol screening process. That's all done with breath alcohol. So those folks, they come in for a breath alcohol test. If the first screening test is positive, the machine shuts down, goes into a recovery phase, gets tested again for calibration, and then the person has a second breath alcohol test, and it should be, within reasonable tolerance of the first test. That's how the machine determines whether it was a erroneous test or not. So if someone has a condition where they produce alcohol vapor from a medical problem, then, and they have documentation of that, then I suppose that you would have to consider that as a medical explanation for their alcohol positive result. The question is are they impaired, right? And that would be determined by not only the result, but their behavior at work. So if their behavior at work is abnormal, not up to snuff, and they have something elevated drugs or alcohol in blood or urine, a positive test or positive breath alcohol test, then you have to be concerned that that's an impairing problem for them.
Okay, thank you. Hopefully this screen that's been up, you saw everyone's email address. If you have any additional questions, feel free to email them. Tim, I've been told, doesn't charge for emails. If you say you were part of this presentation, you can ask him questions. You see at the bottom is my you'll see at the bottom is my email address. I also sent it in the chat if you'd like a copy of this presentation. You have any questions, anything like that, send them my way. Tyler, who you registered with, you can send him an email. Just email one of us. We'll get you the answer to the right person. And my next plug is our next safety peer group. This one was a special one. We normally do them quarterly. So the next regularly scheduled quarterly is March 13th. It is going to be on environmental health hazards, and it's lessons learned from a high hazard industry, which is healthcare. Healthcare is one of the top hazard industries. Actually, more injuries than I think we're top with injuries. So we are having Tim Doherty, who is our Director of Occupational Safety and Health. He's an industrial hygienist. He's going to be giving, the presentation is going to focus on things that will apply to other industries, how we've tackled it, recommendations, and case studies. So that's going to be on March 13th. Save the date, spread the word, and that is back to the traditional format of being at Lehigh Valley Hospital, Muhlenberg. I will say, will that be available as a WebEx? I can give you a definite firm maybe on that one. We'll need to work that out. And otherwise, thank you all for being here. For those who joined us, and if you're here, have some brownies. And thank you.